there's been a burning platform for change within healthcare for decades, but we would be remiss without acknowledging some of the current challenges around the pandemic. And certainly, I think anywhere you look, short staffing is a real strong concern and issue. And just wanted to get your perspective on that in terms of the current state of healthcare.
Yeah, the current state of healthcare is really quite a mess. It's we think about it, the healthcare system before the pandemic, before COVID, was already overburdened. Workers felt like they were running as fast as they could. A lot of the work they were doing was frustrating. They felt that the systems that they had, whether it's electronic medical record systems or other support structures, weren't really serving them. And there was just too much damn work. So that was the condition, in 2 years ago when we were just heading into the pandemic. And then, of course, things only got worse. And it's really interesting because if you look around the country, the organizations that had embraced lean thinking, that is decentralized problem solving by every worker every day, many of them, there was kind of two paths they took. Some of them kind of chucked it out the window and said, we're too busy for this. We can't really spend time finding and fixing root causes. But a lot of them doubled down on it and said, this is the only way out. We have got to redesign our work. We've got to redesign the way we handle COVID patients, the way we handle the emerging treatments, pandemics, vaccine distribution, and the like. And those organizations have really thrived over this time. But our program, even before COVID, focused on trying to understand drivers of burnout and how we could help people overcome the sense of overburden, loss of autonomy and control, the loss of a sense of community, and the lack of transparency that plagued healthcare. And those things drive burnout. So we are especially happy to be continuing this program era of COVID, because those things are even more important now, to try and empower people instead of being the victims of broken processes, that they can take responsibility and help fix some of those problems and help us out of this.